Hi, this is Mary Kaye's Positivity Podcast. I'm a yoga and meditation teacher and life coach. I'm also author of several self-help books. We are honored to have Dr. Margo Roman, who has so many degrees and honors that honestly it was the hardest bio to write. She attended the University of Florida and the Tuskegee Institute of Veterinary Medicine. She has a Harvard University fellowship in pathology from Angel Memorial, is part of the Tufts University anatomy faculty, 30 years of integrative veterinarian medicine, and popular full-time practice. She is trained in homeopathy, an expert on gut health, and has lectured at over 30 conferences and universities. She taught the first course of veterinarian ozone with the Academy of Ozone Therapy. If I listed all of these accomplishments, we would be here for an hour. So I'm just going to say welcome. Thanks for joining us today.
Oh, thank you very much for inviting me. It's so important for people to get an idea of how much these animals are part of our lives and why they're so important for us to have in the way that we live and to be paying attention to them, because they are our canaries in the coal mine, and what they do and what they have could mirror into our lives.
Yeah. As the podcast helps listeners eliminate stressors and stay positive, and we can all credit animals to these calming effects. But before we get started, I wanted to tell our listeners how I found you. I am fortunate to be connected to many healers in wellness and diverse backgrounds and healing modalities. And my last two dogs died mysteriously of cancer. And I never had that growing up, so I wondered if I could be doing anything differently. And all my healer friends said, you have to try Margo Roman. And I had a new Vizsla puppy. And ironically, we went to this pond, and both my Vizsla puppy and my French bulldog got this horrible rash, belly and like armpits and all over their body. And I was still going to a traditional vet, and they put the French bulldog on antibiotics. And I took Rue, my puppy, to your team, and they did something I'd never heard of, really, fecal transplant. And I was amazed because I gave the pill to her, and the next morning she was completely clear of all the rash. It happened overnight. I couldn't believe it. And my other dog was sick for a long time, and I was a believer right there. It doesn't take much to hit you over the head to see that it works. You are well known for treating animals with groundbreaking ozone therapy and IV vitamin C and microbiome modalities. Can you tell us how ozone therapy works?
In a simple form, the body needs oxygen. It's the most needed element that the body, you can't live more than 5 minutes without oxygen. You can hold your breath and try to live, but it's not very easy to do. So if you can encourage or increase oxygen levels in the body, what's negative about that? Your mitochondria, which are 1/10 of your body weight, they thrive on oxygen. And so by giving more oxygen to the system, you're allowing the cells themselves to be more vibrant and more productive in what they do. So that's the first simple thing to look at. But the oxygen molecule of O3, which is an extra oxygen molecule, when you use ozone, it's only a small percentage within a high dosage of oxygen. So your maximum you're probably using is about 3% ozone. But ozone is virucidal, it's bactericidal, it's fungicidal, and then it stimulates the immune system with an overflow of oxygen. So there's this fast die-off of these bacteria, but then it nurtures the cells underneath and allows the body to recover, and it stimulates the immune system in many ways that you can just read papers on the biochemistry and the metabolic ways that ozone works within each cell and how it contributes to good health. So as a veterinarian, I heard of ozone a long time ago, but I didn't know very much about it. And it wasn't until my own horse, Champ, who I had rescued at 16, who was going to be euthanized, and I rescued him for my daughter. And he was well-trained, but he was really sick. And I had him shipped up here, and he looked like a scab. He had no hair, had scabs, and he came on a trailer with all these very expensive racehorses going to the racetrack. And I paid $700 to have him shipped up, and the guy was like this is your pet, right? I said, no, I just had him shipped up. And he said, you just paid me to take this thing, belongs in a shoe factory. I mean, he was like so sick. This poor horse was so bad. And we resurrected him, and he was jumping in horse shows. And my daughter just loved him. He was absolutely a champ, absolutely. And so when he hit 20, he started getting cancer in his eye. And I had 2 clients that had similar situations with their horses and took them in to have the lesion removed from the eyelid. And within a year and a half, and one was a year, both horses had it metastasize into the head and the brain, and then they were euthanized. So they got about a year and a half after the surgery. And I decided, I know holistic medicine. I'm not going to cut it out. I'm going to treat it holistically. And so for 6 years, so till 26, he lived with that lesion in his eye and was jumping and doing everything. And we went away for about two months, our longest vacation time, came back, and the cancer had gotten so much worse. And so I had to get his eye taken out. And I took him to the veterinary school, and they basically told me he'd be dead in 2 days, and I needed to euthanize him immediately, and did ozone, and he lived another 2.5 years jumping in horse shows. And so the whole impact of being told there's nothing you can do, and you just got to give up, and it was like, I'm not giving up on this horse. He is an amazing animal, and to have him continue his life for 2.5 more years, doing all the things that he did, and me riding him twice a week, and other people showing him, it was not fair to take him away that early. So I stood up for ozone therapy because I started using it on him, and then I'll try it on my dogs in the clinic. I'll try it on the cat. I'll try it on my chicken. I'll try it on whatever. And I found that it was just such an amazing tool for infection. And because I'm holistic, I did not want to start throwing antibiotics and pain meds at animals.
Right.
Can I do something different that doesn't damage the body? And antibiotics damage the body.
Right.
And it damages the microbiome, but we didn't use that term till 2000. We knew that antibiotics threw off your gut flora because I had been using probiotics for over 40 years almost, but I didn't want to use why use antibiotics if you don't need to, right?
Right.
And so when you had a tool like ozone, why would you want to step into the antibiotic realms and cause dysbiosis? Now, we have in our body over 4,000 microbes that live in harmony with each other. And when you go on an antibiotic, we have no clue what you just did to yourself. You have no idea how you've distorted your body's immune system.
Yeah, wow. They really hide that. What type of illness is it most helpful for? Just all types of illness, or?
Yeah, I think it's just like a plus to everything because it has the anti-inflammatory component. Because if you have buildup of CO2 in the tissue, that 2 things happen. One is you have inflammation, and 2, it increases cancer cells. So if you have more oxygen in the body, there's less inflammation and less chance of cancer forming. This whole lecture could take 3 hours of just talking about the biochemistry. So if you can increase the oxygen in the body, you can bring down pain because pain is a concentrated area of inflammation.
Right.
So by putting the ozone into that area of pain, the pain stops. So there's procedures called prolozone where you put some prolotherapy in ozone, and it avoids hip surgery, it avoids knee surgery, it avoids back surgery. And if you can inject ozone into an area that's painful, the pain stops. So it's just wonderful that you might not need to use opiates. You may not need to use drugs. You can just use something as simple as ozone with oxygen, and then some of the prolotherapy, which is B vitamins, and then procaine, and also with a little bit of dextrose. So it's so simple on the body, and it does such a beautiful thing.
Why do you think all these cancers have increased with our pets?
We're a toxic pool in this country right now with 90,000 chemicals that are in the environment that weren't there 75 to 100 years ago.
I know.
And each one of those based out of a lot of petroleum, but there's other things that have been formed in there, and we don't know what it does to our microbiome. A lot of them are things that kill bacteria. You have glyphosate, which is Roundup, and that does have a patent for an antibiotic for the intestinal tract. So if our food is laden with glyphosate and we're using it on our lawns and the dogs are licking their paws and they're coming in from people's neighbors' lawns, what do you expect? You can't. And that's just one chemical, which is ubiquitous. because it gets into the water table and it keeps traveling along anywhere. So even organic food probably has some of it in there. But to buy things that have not deliberately been sprayed with glyphosate is where I try to feed myself and my animals and my family.
What should we be feeding dogs and cats, our animals?
That can open up another 3 hours.
You do raw. I know you do raw.
Yeah, this is going to be, some people that do raw are going to listen to this and go, no, you can't do it. I'll spend some time because I think this is really important. I've been feeding raw for almost 37 years. And I was one of the first veterinarians to do raw diet here in Massachusetts and all of New England.
That must have gotten everyone worked up.
Are you kidding? A tough threatened to arrest me going to a public lecture on it. Don't ever feed your dog raw food. And that's part of the reason I have so much problems is I stood up and I said, you can't arrest somebody for coming to a public lecture.
Yeah.
And I stood up and went all the way to the Supreme Court with the ACLU. And that should not be the conversation, is that you get threatened with arrest to bring up information or you get attacked for bringing ideas to the surface. It shouldn't be that way. It should be like,
we got to change that.
What do you know? How do you explain things? So doing the raw diet, the first one I had was a client that came to me, and she had a little Portuguese water dog puppy. And she said, I want to feed raw. And I said, I don't know anything about it. I'm told you can't do that. You get salmonella, you get E. coli, you get this, you get that. And she said, I want to do it. And I said, okay, let me watch what you're doing. So she took me out to the parking lot. We put a piece of cardboard down so the gravel wouldn't get onto the chicken quarter. And the dog just chewed away and ate the whole thing. And I'm just watching it. I'm going, oh, my God, that's truly amazing. The dog's not choking. It was eating. And that puppy was the healthiest puppy in my entire clinic.
You're kidding.
And I watched that dog's coat and eyes. And I said, you know what? Who am I? I'm educated by dog food companies. What do they want to sell?
Dog food.
Exactly. So I said, I'm going to try doing raw diet on some clients that have issues, skin issues and stuff. And the changes I saw were so impressive that I thought, oh, my God, I've got to switch as many people as I can. So I did. And I saw this great improvement, this huge improvement in feeding a food, not feeding a processed product that has a 2-year shelf life, that is preserved with ethoxyquin and has chemicals and dyes and flavoring to make the dog eat it.
Right.
And so that was a big, huge chunk of how I was able to improve animals' health just by giving food, not giving processed kibbles. Oh, it totally makes sense. I got a puppy, and I started to raise it on the raw diet. And generation after generation, these are the standard poodles that I have, and they were all raised on a raw diet starting out, and that was almost 30 years ago. And to raise that dog and then the next generation and trying to improve the breed by not over-vaccinating, by feeding a healthy diet. The house that I built 42 years ago is a green, sustainable home in Virgin Woods, and everything in my house is organic. So
you were ahead of your time.
Yeah, the house is passive solar. I have been 30 years ahead of everyone, you know. So, and it's hard because nobody wants to believe you. When we were building our house with double insulation, and everybody thought, well, that's a waste of money. Why do you have to put solar hot water on? And you don't need that kind of thing. So anyway, that's just because I think about things and I want my earth to be there for me, right?
Right.
Anyway, I was all into eating raw diet, but I'm also very conscientious about eating less meat. And I became more of a plant-based individual and trying hard to be as vegan as possible wherever I can. And what happened is that we had a meeting about 12 years ago of a group of veterinarians very concerned, including Richard Pitcairn and a bunch of very influential veterinarians. And we had a meeting in his home and about the sustainability and the compassion about what we feed our animals. And how can we do this in a compassionate, caring thing as well as care about the environment. And so Susan Pitcairn did a whole feasibility study on what the impact of feeding a 70-pound dog would be for its lifetime, feeding a meat-based diet. And meat-based, the raw meat is actually a higher meat, but even the regular dog foods have a high meat-based component to it. But what is the impact on our environment? So feeding one 70-pound dog for 11 years, it's 8 million gallons of water. This is just their meat. 180 tons of grain, 365,000 miles worth of petroleum to take the feed to those chickens and to that beef and cow, and then down to the slaughterhouse, packing house, processing plant, all of that. The 5.5 acres of rainforest that has to be cut down to plant genetically modified corn, soy, and wheat for feeding these animals. But the worst part is I'm going to tell that client with that new golden retriever puppy to kill 8,127 animals. And that's not ethical for me anymore. And I found it really hard to tell people to feed such a high percentage of meat. So I was on a mission to try to see if could I raise my next litters. So I've raised another 4 litters now with a plant-based diet. And they are thriving. It's not 100% at all. It's 92% plant. It's all fresh. I make it myself. It takes 16 to 20 hours to make it. It's a lot of work, and I do it every 3 weeks. And I have 2 other people helping me do it, and it's a lot of work. But when I finish making my diet for the dogs, I have saved over 25 animals' lives because I'm feeding 8 dogs over a 3-week period. So that is a significant number of lives that I save as a veterinarian. And what they feel is that if we all went more plant-based, and especially animals don't have to eat meat, but if I've raised 4 litters without that predominant meat base and only a small percentage, they can do it. We can do it.
But if you put down a plate of your raw meat and a plate of this vegetable-based concoction, what would the dogs eat?
Are you kidding me? They'd eat the meat. They don't like my food. I mean, my dogs don't. No, they don't. They eat it when they're hungry. We put meat on it, so I use a lot of, my main meat source is from hunting season, from using bits of the hunting of the deer.
Yeah.
I had 2 clients that if the deer got hit by a car, they would harvest the meat for the people, and then the byproduct stuff they would give to me. And I do buy some things like tripe and stuff like that from Oma's Pride, which I put, instead of giving them 2 cups of that, I give them a teaspoon. I want the bacteria from that and the flavoring from it. But we know the fiber of the food is what makes up the microbiome and gives it the most health to it, not the putrefied meat. But I want the putrefied meat in there because they're bacteria that have been around for a long time that animals have been eating, and I want those in my dogs too as well. But I feel if I have to, my dogs don't weigh 70 pounds, but if I had to kill 4,000 animals per dog, I have 8 dogs. How many animals am I killing for my dogs? It makes me ill to think of that, and it's like, why?
You're a true vet.
But of course, my dogs would love to eat meat. Are you kidding me?
Yeah.
That whole commercial, dogs love, absolutely. But can they live without it? Yes. And how do we live on this earth? I want my grandkids to have dogs.
Yeah.
They're dying of cancer so much that
I know.
I guess we'll think of them as having the lifespan of a hamster, that they can live 5 years or 4 years. But we should have dogs living to 20.
I know.
And that's rare.
Right.
It's rare.
Go ahead, sorry.
Go ahead.
What is the microbiome restorative therapy?
Restorative. Okay. The term fecal microbiota transplantation is a term that has been used since 2010. And I had been talking about doing fecal transplants or giving dogs poop for years because it made logic sense to me. In veterinary school, we were doing it on cows. We were giving rumen to babies. We'd have a fistula on the rumen, and we'd pull it out, and we'd give it to newborns that were, needed to be a little extra. We'd also give it to pigs. And then horses will eat poop on the ground, too, as well. There's this precedence of animals eating poop, and dogs eat poop anyway, right? Why not give them the best that I can give them? Give them the top of the line, healthiest poop that has been protected for 30 years, 7 generations. At that time, it wasn't 7 generations. It was only 3 generations. Back in 2011-12, I decided to do a fecal transplant on this one dog, and his name was Stovin, and he was a standard poodle that at 9 weeks of age was put on antibiotics at the referral hospital in Boston. And he had been on antibiotics since he was 9 weeks of age and still had diarrhea. And they couldn't control the diarrhea, and he was losing weight, having hemorrhagic gastroenteritis, and dying. They were going to do exploratory surgery on what was going on with his gut because they couldn't stop the bleeding. He had a blood transfusion. And so the owner came to me and they had to carry the dog in because it was 3.5. It looked like a 17-year-old dog. Brought this dog in, And he was so sad, and I said, let's build him up. So within 3 days, I had, between acupuncture, ozone, and all the nutraceuticals, we had a normal stool in 5 days, and the doctors at the referral hospital said, finally, the antibiotics kicked in after 2 months. And I had taken him off everything, and so he had recovered from the diarrhea, but he was so immune compromised. They knew he had Addison's, so that was putting another damper on him. But he also had this Plechner syndrome, which is a terminology that I use that would also be a 3-hour lecture. But Dr. Plechner was a veterinarian who has passed away about 10 years ago at 80, so he has been doing that for a long time, that felt that there was an endocrine imbalance in the gut and endocrine balance with the thyroid, but it was never really defined. But I followed his protocol on many cases that other hospitals couldn't take care of, and we would turn these animals around and give them more life. What happened is I decided this dog was so depleted, let's do a fecal transplant. And literally, my improvement was going up straight to a 90-degree angle. I never have seen a dog recover so rapidly from that fecal transplant.
Right.
And I got pictures of him 5 or 6 days later, and he could stand. And he was feeble, but he couldn't stand when he came in. And he was this thriving, white standard poodle who could have been in a dog show, gorgeous. Mm-hmm. So to watch that transformation from the fecal transplant gave me the power to think about, oh my God, what can I do for this? So each time I'd have a case that was really challenging that had diarrhea, I would give them a fecal transplant. And lo and behold, not only did the fecal change their poop, but they got better behavior, they got better coats, their ears cleared up, their eyes cleared up, their skin was better, their lab work got better. Everything improved from the ozone in the fecal transplant and the change in diet. So this microbiome restorative therapy, instead of just using FMT, which is fecal microbiota transplantation, I thought that was a gross thing to talk, like to throw fecal, just transplant poop. So it's really microbiome restorative therapy. So we're utilizing the microbiome and restoring it with other nutraceuticals and utilizing medical ozone, which will get rid of the biofilm. And what biofilm is, it's a slime in your mouth and it's a slime in your dog's bowl. It's bacteria that has grown and forms like a slime. Mm-hmm. And that prevents new things from coming in. It's important to reduce that biofilm with food and certain enzymes in food, and especially like berries and bromelain and papain from papaya. Those things help break up the biofilm so that the bacteria could be diverse and not be just one kind of bacteria. Mm-hmm. And so diet and nutrition are a really big part of making the microbiome more successful. So you want success. You want to be sure that we have a good balance in the gut, and that's where this restorative therapy is. The reason I'd use that term is I wasn't convinced that it was only in the gut, that we should have other parts of the body are covered with bacteria. Talking about this 12, 13 years ago, people thought I was kooky. This is just such a great, impressive comment. Is in 2000, there was one article written on microbiome, okay? In 2017, there were 17,000. In April 23, there were 250,000 PubMed articles with microbiome.
Wow.
So the science of this is exploding. So those of us that were working with it 30 years ago, we're not really working with it, but I was protecting it. I wasn't trying to knock it away and kill it. I was nurturing it instead of trying to kill it, and then utilizing it in 2011 and 12 to start up doing this stuff and realizing, oh my God, I was protecting a garden instead of trying to stamp it down and kill it all off.
Mm-hmm. So basically, for people who don't understand, when you introduce healthy fecal matter into the gut just multiplies the healthy matter that's been in.
For me, just doing what we call FMT mm-hmm. is not enough for good success. Yeah. That's why I've coined the word microbiome restorative therapy, or MBRT. Mm-hmm. And it's a technique of including FMT, but it's also basically developing the terrain of the gut, allowing the gut to be ready for this fecal matter to come in. Mm-hmm. So when that fecal comes in, it's not, oh my God, this is like a concrete, you want me to sleep on this concrete bed? So you want to make some of the comforts of where they came from mesh in there in a good way.
Mm-hmm.
So we use medical ozone first, and we do it without anesthesia. I taught referral hospitals how to do fecal transplants, and it's being utilized all over the world now with fecal transplant, how we do it. But they're not using ozone, and that's a big, huge positive that they're not doing. So they're not putting the ozone in first, disrupting the biofilm, and then putting the fecal right where you disrupted the biofilm. So the slime that's there is not interfering with the new stuff coming in, and you want the new stuff to get it. It's like thinking about a bunch of people moving into a community. You want them to feel welcomed. You don't want them to be like, I can't sit here. There's nothing for me to hold on to. So you want that extra space for them to thrive.
Why are people in the medical profession so slow to adapt these groundbreaking treatments for animals for people?
It's fear. It's fear and money. It's probably more money than fear, okay?
Oh, okay.
It's money.
Because it's not expensive?
You could do your own fecal transplant, but you don't need... There used to be a website that gave you how to do everything that's somehow been
taken down
from the internet. Yeah, but to do... Dogs eat poop anyway, right? They eat poop, whatever. But to give them a poop from a dog walking down the street, you have no clue what was in that dog's gut.
Right.
It could be so much worse than your own dog. To find animals like ours, and that's why we have 3 companies that buy our poop. Animal Biome, which is based in Oakland, that does the 16S testing, the DNA testing. They use ours, but you have to request my dog's poop. You have to request that it's naturally reared, never antibiotic, plant-based, raw dog poop. They have regular poop from dogs that are in the neighborhood that have passed the 16S test, but our dogs are the ones that are a legacy of years. And the other company is Legacy Biome, and legacybiome.com is based in Canada, and they take our poop and put it through their process up in Canada, and then they sell to the public. So anyone can get Legacy Biome's poop directly from them, so any of your listeners all over can order that. But that's just one component. I think the whole thing together with the ozone, with the nutritional changes, once you introduce the capsules, and they both sell freeze-dried capsules. We sell slurries, nuggets, we have about 7 or 8 different types of ways of getting it into your dog, but we only sell to veterinarians and to our clients. We sell because we want to make sure that somebody is overseeing the issue.
Right.
I really feel that the combination of the MBRT program that we put together has much higher success. Because if your donor is mediocre, you're not going to get a good fix.
Right.
If you're not using ozone, you're going to have competition and biofilm that's going to prevent the FMT from seeding well in there. It still works. But if I'm going to do it, let's do the best we can, so we do it the best way we can do for these animals.
If a dog's super high energy and won't stay still, is that hard for ozone therapy?
No. If they don't like having it done, very rarely do I have to sedate an animal to do something to them.
Right.
We have a fear-free practice, and where we're putting something into them, it's like a thermometer that's going in. And most dogs don't like a thermometer. They don't like having their temperature taken, right?
Right.
But it's a very similar kind of sensation for them to have this done.
Yeah.
So most dogs, if they're hyper and they're jumping all over the place, we try to calm them down. And if they are aggressive, then we may have to sedate them because it's a risk to the staff to do anything, whether you're taking blood from them or you're trying to check a paw or something like that and they're trying to kill you. You have to do something.
Yeah. If you had a pet with PTSD or behavioral issues like aggression, can that be treated with diet or alternative medicines?
Oh, absolutely. It should be tried before you go on Prozac and SSIs and all that. I'll tell you a story about this little dog, Dante. Okay, so that was the first thing. Naming him the devil was not a good idea.
Totally.
So
what was
he was a little skipper key who the woman had called me in the fall and said, my dog is so aggressive, I want to put it to sleep. And I said, have you been to a behavior? She said, yes, I have. Has he been to someone who put him on medication? Yes, I have. I said, go back and try the behaviorist again and see if you can work with it. So she did, and she calls me again in January and says, I want to put my dog to sleep. He's just so aggressive, we can't deal with him. So I thought, you know what, let her come in. It's a little dog. You don't think, oh, my, such a bad dog, right? If it was a 75-pound dog, this was a 12-pound dog, right?
Right. How scary is he?
How scary. I'll tell you how scary it was. So she's sitting on the chair, And I'm sitting across on the exam table on a higher chair. And I'm talking to her, and he's looking at me. And I'm talking about he's got to be a good boy and everything. Suddenly, I said, can you give me the leash? So as soon as she handed me the leash, doesn't he jump up on the chair, jump up, and is going to grab my nose.
Oh,
He's
wow.
just got his mouth open, ready to take my face off. And I didn't want to turn my eyes because I knew if I turned my eyes, he'd bite me.
Right.
So I kept talking to her and telling her how, he's such a nice dog. I tried not to be fearful. So I handed her the leash. I said, here, take it back. And he jumped off and he got back to her. And he was so bad. I've never had a little dog ever do that to me. It was scary. His head was right by my, like going to take my eye and nose off at the same if I turned my eye, right? So anyway, so I said to her, give me a week. Give me a week to try to see if we can do something, because she'd been everywhere, right? So I said, give me a week. She was a pretty intelligent woman, and she said, okay, I'll give you a week. That was one where we just held him down and did everything to him at once, because he was just so hard to do anything to. And we screened him for Pleckner. He was hypothyroid. Nobody had screened him for that, but he was hypothyroid, which can affect your behavior, but that wasn't the main piece of it. We took the blood, we did the fecal transplant, we gave him vitamins, we gave him ozone, we did UVBI, we did the whole treatment, our whole treatment to him. And of course, we give them 2 vitamin shots, and those vitamin shots can sting, and they can be a problem with some dogs. And so we diluted it with a pocket of ozonated saline, which could reduce the pain. And I warned her, I said, he might be sensitive in those spots, so don't worry about it, because some dogs, we haven't given it to him before, we don't know how he'll react to it. She calls me the next day and she says, I want him euthanized immediately. And I said, you're supposed to give me a week. He won't let me touch him anywhere. He won't. I said, it's probably the vitamins. Don't get upset. Just leave him alone. Don't bother him.
Right.
She said, I'm taking him in and I'm getting him euthanized. I said, just give me a week. Give me 5 days. You only gave me not even 24 hours. So the next day he has diarrhea. And he had diarrhea a lot before. He had diarrhea all over the place. And she says, I'm taking him in and euthanizing him. I said, he's got to get rid of all the stuff that's inside him. The poop stayed in him for 24 hours, but what happens to the old stuff that has to come out? The new stuff has come in there, but the old stuff needs to come out. Tried to explain it to her, and she said, okay. About 3 days later, the diarrhea had stopped, the pain in the body had stopped, and I said, how's he doing? I don't know. I don't know if I can do this anymore. I said, but you promised me at least 5 days. Please give me 5 days.
Yeah.
So she said, I can't do this anymore. So I said, is there anything different that's happened in this dog? She said, yeah, usually when the doorbell rings, he will go to the door and he will bark the entire day from one doorbell ring, and just bark and bark and bark and bark. And she said, he went to the door, he saw through the crack, he barked and barked, and went back to his bed and laid down. I said, that's a good thing, right?
Right.
She said, yeah, I guess that is a good thing. Lo and behold, like in a week or even 5 days, it's a different dog. Different dog.
Wow.
She couldn't walk down the street without this dog trying to take off a human arm or a dog's leg. And he was little, and she couldn't even go take a walk. Her neighbors all knew when she went outside to get back inside because she was a terror.
Oh, this poor little
and
dog.
So what was so interesting to me as a veterinarian, and I noticed that the eyes were bulging, but I thought that was what the dog looked like. It looked like a Chihuahua more than it did a Schipperke. But she said the sclera around the eyes was always slightly yellow because she was actually a nurse. She was always yellow, and his eyes were always bulging out of his head. And after we got him settled, his eyes went back into his head, and everything was white around it. Those kind of things, you look at that, and he didn't have diarrhea because he would have periodic diarrhea. That all cleared up. And he changed so radically from this aggressive dog to this dog who could be, you wouldn't take your kids into the house and want to play with this dog, right? Because I wouldn't trust him.
Right.
But from the difference between what he was and how he behaved was complete night and day.
It sounds like it.
Yeah,
you can tell
really
you
is.
love
So,
animals because there are not many people that would have kept going with a dog like that.
it's hard to give up if you think that there's another choice.
Right.
And that's what I am trying to convince my colleagues and the veterinary board. If you know another option that you can try, why are you forbidden to do it? Or they don't want you to, because whether they don't want other veterinarians to look bad because they said there's the only thing you can do is euthanasia, and then you take them and you go, well, let's try this and this. If you can give the body a chance to do its job and take care of it, it doesn't want to die. The body doesn't want to die, so how do we make it better as best we can? And I think that's what holistic medicine is trying to do. So for people out there that are trying to find another way to help their animal, to try to find holistic vets that are thinking with a broader brush. If you don't have training in acupuncture, and you don't have training in chiropractic, and you don't have training in herbs and or homeopathy, or ozone therapy, or fecal transplant, microbiome, restorative therapy, you don't even have those tools. And if you don't have those tools, you're missing a huge amount of space to help your animal heal. And that's where I've been on this mission for years, and the boards hate me because I speak out. I look at my veterinary oath, and if everybody wants to read the veterinary oath, go and look up the AVMA veterinary oath. And if you don't have doctors that are willing to use scientific skills and knowledge and seek out more information, they're not following their oath. And the oath is what I've lived by for 48 years. So if I'm told, don't do this and don't do that, and my oath says I should and I should, am I bad because I wanted to look for more? And according to
no, you're beyond your
the
years.
board in my state, you can't do that because the oath is just an oath, and we don't believe in the oath. And that's what the Massachusetts Veterinary Board said.
We have to change that.
Is insulting. Yeah, we have to change that. And we have to make our veterinarians want to explore other ways to help animals. Because in my profession, sadly, if you bring it to a vet and the vet says, I can't think of anything else we can do for this dog, I'm really sorry, we're going to need to put the dog down. And they never study any of these other things, you're being denied care.
Yeah, I agree.
I really believe that. I really believe it because if your dog had diarrhea for 2 years and you can't control it, and you've never tried some of these other things,
yeah, that's a problem.
How can you say there's nothing you can do?
Right.
Because I get those dogs 2 years, 3 years, 4 years later, and we give them the fecal, and they have normal stools in 48 hours.
Yeah, no, I saw it firsthand.
What is that about?
Yeah.
That's not fair to anyone, and but it's hard being a pioneer. It's hard doing these things. And,
you always get attacked.
When I started doing acupuncture, I was the first woman to take the veterinary acupuncture course in 1975-76 in vet school. And it was the second acupuncture course given in the United States, and they let me take it as a token kind of thing because women didn't go to vet school. That was not a female job.
Wow.
When I applied to veterinary school, I was told the only reason I wanted to go to vet school was to find a husband who was a veterinarian. And I was insulted and just traumatized by that I really wanted to be a vet. When they said, no, it's just a man's job. You just don't get in. And there were so few veterinary schools, and my chances of getting in were 1 to 300. It's something that I've strived and believed in and work hard and follow my oath. And because I follow my oath, I'm getting kicked in the face. So I don't think that's fair.
Keep following it because I think the world is going to wake up at some point and realize how much we can learn from people like you, truly. You've made such a difference in the world, and thinking outside the box should be celebrated. Thank you.
Okay.
A horse's heart is stronger than a human heart, and the magnetic field they produce has such a positive effect on the human body. Do you see with animals our energy affecting the animal and making them sick or vice versa?
Oh, absolutely. I think there's a definite connection between our energy, and if you're in touch with your animal, if you don't care about your animal and it's just a farm animal or it's not an animal in your home that you love and care for, then I don't think there's a connection. But I think if you're connected and they get you and you get them, I think it's such an amazing thing that we are able to do with these creatures that have been around probably way longer than the human race has been around.
Yeah.
And then the microbiome has been there for 4,000 million years. If you talk about the microbiome running the body, the microbiome is running our bodies. There's 100 trillion microbes in a normal human, and it's 10 times more cells, 10 times more microbes than cells. So we've got to be paying attention to what these guys want. And if we're poisoning them every single day and trying to knock them out and get rid of it, we're predisposing people and animals to more illness because it doesn't have any natural immunity anymore because the microbiome is so distorted.
Yeah. What's your most impressive career-related accomplishment?
Okay, what was the most impressive case? I just published a case. This case is peer-reviewed, journal. People can Google it and try to find it. but it's in the International Ozone Journal. And this was a case that was from beginning of 22. And this dog, it was a Rottweiler who came in. His name was Titan. He came in, and the backstory on him was he was hit by a car. He's 14-month-old, Roddy, hit by a car. He had a fracture of L7, which was comminuted, and his sacrum was luxated. He presented paralyzed in the back, with no bladder tone, no anal tone, in shock.
Oh.
And they took him to part of the university in Walpole, and they took an x-ray of his back, and they came out and they told her, this dog is a big dog. He's going to have no anal tone, no bladder tone. It's best if you euthanize him. And it's too much for a dog to go through this whole thing.
Mm-hmm.
You got to euthanize him. How are you going to? So she said, no, I want everything done. So she took him to the main campus of the university, and they did an MRI, and 2 surgeons came out and said to her, the kindest and the best thing for this dog is to euthanize it. He'll never have anal tone. He'll never have bladder tone. He'll have bladder infections all the time. He'll be dripping stool. We can get back the use of the left leg, but the right leg he'll drag. But we can get the left leg to work.
Mm-hmm.
And she said, no, I'm a nursing student. I love him. He's my favorite dog I've ever had. I can't do this. I can't do this.
Mm-hmm.
So she went, they did the surgery, and exactly what they said was going to happen. The dog got use of the left leg, the right leg the dog dragged. And when I saw the dog 9.5 weeks after surgery, the dog was leaning on the wall and supporting himself in my exam room, and was using the left leg, and the right leg he could use for about 20 feet and then couldn't use it anymore.
Mm-hmm.
And but he was smearing feces and blood because under his little Rottweiler tail, the excoriating diarrhea had ulcerated underneath his tail, and there was no skin under there from the diarrhea.
Oh, God.
And his bladder and his urine smelled like dead fish, and he was dribbling urine.
Oh, God.
So she had to either catheterize him or express him. But then there was diarrhea everywhere. He was in 2 diapers, one for the front penis and the other one for the coming out the rear end. So he lived in 2 diapers.
Oh, God.
And she came to me. Dog was on chloramphenicol. Now, chloramphenicol is an antibiotic that has been taken off the market because it causes serious issues with humans. And the doctors at the university told her to wear gloves. But nobody told her that she should watch where the urine goes, because if the chloramphenicol is supposed to be going into the urine, isn't there chloramphenicol still in the urine, right?
Right.
So anyway, her 3-year-old walked through the urine because dog was dribbling and was in the ER from head to toe, body rash in an emergent state.
Oh, come on.
But there was no other treatment for the dog because the antibiotic resistance, the only antibiotic that it was even sensitive to, which it wasn't because it was 9.5 weeks and it didn't do anything, it was the chloramphenicol. So they said either euthanize your dog or stay on the chloramphenicol. So she stayed on the chloramphenicol, kept her son away from the urine, and wore gloves and was doing this. So this poor dog was fearful, was vibrating in fear when it walked in my clinic. You could see his whole body just vibrate.
God.
And so traumatized by everything, right?
Right.
He came in, and I didn't know him, so I didn't know his personality. I didn't know if he was going to be aggressive, but he wasn't aggressive. He was just fearful,
resigned,
and just frightened of everything, right?
Right.
Anyway, we did ozone by ultraviolet blood therapy. We have this hemolumin, which is UVA, UVC, amber, blue, green, and red light, and it's used a lot in treating humans for Lyme disease and cancer and a bunch of stuff. So we did that. We stopped everything: chloramphenicol, the parasympathetic medication. We stopped all the drugs that the dog was being on completely.
Mm-hmm. Right.
Started an oral microbiome. We did put a catheter in his bladder, flushed his bladder with ozone.
Wow.
And flushed it with ozonated saline.
Yeah.
And then the most interesting piece that I did was, I've been doing acupuncture for 47 years or whatever.
Yeah.
And I've never had this happen. So I flooded the back with ozonated saline, and I did what's called aquapuncture, which I've done thousands of times.
Mm-hmm.
And you put a needle down with B12, and it felt like I was going through half an inch or an inch probably of beef jerky. That I was taking a Phillips head screwdriver trying to grind it through this beef jerky to get through to anywhere. It was more than an inch. It was like an inch and a half maybe. Mm-hmm. And I had to grind the needle down through this back because it was like a solid plate of, I've never felt that before, between the fracture and the wound and all, it was like a solid flat thing.
Yeah.
And that we did rectal ozone on the dog, and we gave it the vitamin shots. We started on all the nutraceuticals that we do for the MBRT.
Mm-hmm.
And I did that day 1, okay? Day 2, the dog was home. Day 3, it came in again. We did the same thing again. On day 4, the dog wagged its tail for the first time. It had not moved anything in the back end.
Oh, my goodness.
Which we have a video of the owners just laughing. I couldn't believe that the tail was wagging, right?
Aww.
And so then day 5, we gave the dog a fecal transplant, did all of the same treatments, the UVBI, the ozone, flushed the bladder, did all of that. Day 6, she calls me, and she said, we just walked 2 miles. He pooped on his own normal stool, and he urinated on his own clear urine.
I have chills. That's a great...
I was like, are you kidding me? She said, no. I said, he's walking 2 miles? She said, yes. And
both legs?
Happy as can be. He is, both legs. He is prancing.
I love these stories. That's amazing.
Isn't that amazing? So these are the kind of cases that
keep you going.
Rethink how things work, right?
Right.
So all the neurotransmitters from the gut helped him regain all of that, the musculoskeletal function, right? Uh-huh. The serotonin and all of the oxytocin, all these he was his same happy, sweet self that in 5 days. 5 days, right? Never would have seen that with one of the components that I had. It was a combination of the ozone stopping the pain, stopping the inflammation, allowing the acupuncture to actually get to where it's going, which is trying to separate in the fascia and the fascial spaces, and allowing that meridian to work to get that tail to wag, because it couldn't even move the back end at all. Mm-hmm. Here we have a dog that in 5 days, went from almost ready to euthanize to having bladder tone and anal tone. That was probably a culmination of all the years of my studying doing that. And again, I think to myself, the veterinary board has shut me down for 2 years. I can't do that now. I can't think differently and help other people. They've got me handcuffed and say, you can't do anything.
That's a crime. That's a crime.
It's a crime. I think it's criminal. I think it's criminal.
It is criminal. How can the public help doctors like you that are treating animals holistically?
I think writing to the governor and writing to the boards and writing to the Mass Veterinary Medical Association. We need a voice, and I've tried to let it go through the legal channel, and it's not there. So we need the public to speak out.
You know what I don't understand is when I have to go to the doctor for something and get an opinion, you go and get 2 or 3 opinions, and they all differ. And you make up your mind on what you think makes the most sense for your situation. And it seems like we've lost sight of that it's okay to get different opinions and have different ways of looking at health for people.
But that's where this whole health freedom is. You have it in the United States, when in Massachusetts, you have the right, if you want to have an abortion or you want to take care of your body in a certain way, you're allowed to do that.
Right.
If you want to take care of your body in another way, they don't want you to do that. You have to follow the rules of what they want you to do, and I don't think that's fair. I think people that do integrative medicine, there may be people that don't have the training and the expertise that others do, but hopefully people will go to individuals that have studied and understand stuff and have been involved in teaching it and educating others. And that's what I do. And I feel as much as I know nothing, and I admit it, especially on the microbiome, I've been doing it longer than probably anyone else in this country in veterinary medicine, and probably close to the longest with people that have been involved in it. And I still feel like we haven't even touched the beginning of that iceberg. Right. We don't even know what it is. So I'm happy to admit that I don't know anything, but other people know everything. You try to say, what about
exactly.
I don't need to know that, right?
Yeah.
So it's really not fair, and I'm speaking out now because I haven't been speaking out as much because I kept thinking, let's let the legal system do its job, and we're going to the Supreme Court of Massachusetts now. I think people need a voice and have to talk about these things because it's going to affect our health too as well. If we can't get the freedom to help our animals, how do we have the freedom to help ourselves?
We also know that the gut talks to the brain. So all of these stories make so much sense that you would think they would invest in healing animals this way.
I think it's happening. It's definitely happening because both Purina and Hills, who condemned me for feeding the raw diet at a conference and condemned me for talking about probiotics and condemned me for not feeding to my clients. So they now have research and institutes and are trying to study the microbiome, and I'm thrilled. Let progress happen, having them understand the value of it and understand that not just adding one part that increases the microbiome is not enough. You need the whole food. You need live food. You need fresh food.
Right.
Processed food is missing a bunch of stuff that I think the wild in the animal does not get from eating heavily processed food.
Right. I mean, it's just common sense. What did animals eat? What did dogs eat like hundreds and hundreds of years ago? Of course it was raw.
Yeah, right.
So it makes sense.
Right.
Well, is there any question that I didn't ask you that you want to share? You think something's important to share that we may have missed?
I think we cover a lot. There's so many opportunities for people to learn about integrative medicine. There's a lot of summits that are around, and I've spoke at many of them. There's pet summits. There's conferences that are going on around the country that are highlighting the need to have all this integrative medicine as part of the animal's health. And we have this project that we had worked on and started in 2004 and 5 after my horse issue with the university, and it's called Dr. Do More. And instead of Dr. Doolittle, it's Dr. Do More. And that video is up on our website. And we had tried to do a documentary series back then and just didn't get it. But we got 3 million hits on that in 2007 to 2008.
Holy cow.
We got a lot of hits. Nobody got that back then. Now everybody gets those things, right? But back then that was a lot, right? But the idea is, how do we talk about this? How do we use our animals to be our teachers and learn from them and understand that they are unique in what they get exposed to in your home? So if they're getting sick from something in your home and having allergies or scratching or itching or what, there could be something in your home that's not healthy. So always reflect on that, mirror them to you so that you can learn from them and help yourself too as well.
I feel like animals will tell us about things in the home before you experience it even. Do you know what I mean?
Right, because they age 7 times faster than we do. So if they're exposed to some chemical that you're using in your home, or they're exposed to the air quality or exposed to your lawn or whatever, and we know like Roundup causes lymphoma. We've known that for 30 years. And you try to talk about that, and no, you can't talk about that. You can't talk about that.
Yes,
that's
wrong.
A huge company. They're going to squish you.
Right.
That's what they do, is these big companies and the universities will squish you like a bug because they know they have so much money and power behind them with corporations that they know that one person talking out is not going to make a difference. If all of us start demanding that we want cleaner water, we want less chemicals, we want healthier food.
I'm just going to have you share how our audience can get in touch with you or your website information.
My clinic, they can go to my website, which is www.mashvet.com, and they can read about the clinic, and there's a lot on the blogs. They can also Google my name, and you'll find a lot of webinars and lectures that I've done. I'm going to be speaking at several universities next month and in November and teaching in the veterinary conferences. So I do a lot of lecturing and teaching. It's sad to me that most of the lectures that I do are not in my state of Massachusetts because as progressive as Massachusetts thinks, it is not open to integrative medicine, and it's sad to me. That's something that is just amazing to me, that they don't have an integrative center at the university. That would be something, is to get in touch with the university and say, we need to have integrative medicine taught here. We are demanding it as consumers, and those of you that are calling from other states, demand it from their veterinary school that they need to have integrative coursework. Because so many people are doing this anyway, and they're not even telling their veterinarians.
The tide is turning. I feel like the tide is turning. I really do. People are getting angry now that this is being withheld from us.
Yeah, I agree. If you go and you talk to your veterinarian about raw diet, and they go and condemn you and tell you, oh, you're going to kill your dog, and you're going to get salmonella and E. coli, in 37 years of feed, I've never seen it.
Oh, wow.
Never seen it.
There's a statement.
And I've seen all these recalls on dog food with melamine and toxic levels of vitamin D, all this, and the other things, and they've had E. coli and salmonella in dog food. They had E. coli, listeriosis in salami this past few weeks. So everybody, if your animal is more balanced, these outbreaks probably aren't going to be as difficult because there's a symbiosis going on there, and everybody's got E. coli and salmonella in their gut. And there's 4,000 species. If you don't, you're probably something wrong with you.
Right.
But we don't want an overgrowth of something. But the best way is to try to keep everything in copacetic and balanced and not be, I think the worst culprit is antibiotics.
Yeah.
And because that's one thing that people should know. This is the new epidemic, is antibiotic resistance. Antimicrobial resistance is killing 1.3 million humans every year in the world. And they expect it to go up to 5 million, not 5,000, 5 million. So if that's the biggest cause of death in the world is antibiotic resistance, and we are overusing antibiotics. I haven't used antibiotics for dental in 30 years. 30 years.
Right.
And the standard is to put them on clindamycin after the dental. And one course of clindamycin can knock your microbiome out for an entire year, and you may never get it back in balance.
Wow.
And what are they doing? When I use ozone for my dentals, they work great. You flush the pockets with ozone. You give them some ozonated oil to put on the extracted tooth area.
Yeah.
I've never seen an infection. Why would I do that?
Right.
Because there's 400 species of bacteria living in harmony in your mouth. And I've never, in my career, have seen somebody culture the mouth out before they put them on antibiotics. They just throw them on antibiotics. That, to me, is not good medicine. That's over antibiotic. I don't want to say the word, but it's bad medicine.
Yeah. We were brainwashed years ago to think that antibiotics work because you'd see quick results, whereas I feel holistically it takes a little bit longer. You just have to be patient. Just like that woman. Yeah. Go ahead.
No, but I was going to say that when my kids were little, they would stick kids on antibiotic when they had a sore throat.
Yeah.
And I was like, are you kidding me? Why are they doing that? Most of the kids had a cold, but they would put them on antibiotics, and the parents would say, if they're on antibiotics, they can go back to school. I'm like, I don't understand. This is viral. But they're on antibiotics. What does that mean? It was so ridiculous. And then those kids became so allergic to everything. They were allergic. So you're disrupting the balance of everything, and they become not healthy. And so that's the scary thing, is that the generation now of pediatricians don't do that as much. But when my kids were little, it was, if they had a little ear problem, just put them on antibiotics, fine. Put them on antibiotics, fine.
Yeah.
Put them on it. I'm like, no.
Right.
So I was so grateful that I studied homeopathy in '93 that I could navigate my family's use of drugs, because otherwise they would have been on and off antibiotics all the time as little kids.
Yeah.
Didn't have issues, but if they did, they would be jumping on that.
Yeah.
And I want antibiotics when I need them. I absolutely do.
Yeah.
But we don't have them anymore because of disuse. They've used it for everything, and we need it for our military. We need it for civilians. We need it, but if we've abused it, then it's not going to be there for us.
I'm cracking up because I tried to hide all the squeaky toys before the podcast, but now the puppy's going crazy with the squeaky toy. I really value all your work and appreciate all your knowledge, and I have learned so much just in this short conversation. I could talk to you for hours. So thank you so much for joining us, and I hope everyone gets in touch with you and reads your, I hope everyone checks out your website and reads your blogs and the research you've done, because you are on the forefront of health and wellness for our pets and animals, and I appreciate you.
I appreciate your appreciation, because it's hard being in the trenches and getting attacked and spending money on lawyers, and I'm exhausting my retirement paying for lawyers to go to the Supreme Court. Anyone out there that wants to help me pursue this, please get in touch with me, because we have to stand up, and we have to have people that are willing to stand up.
No, we do.
And it's not going to change if we all sit on our hands and go, just keep your mouth shut and do everything under the table. I feel like, how do we make better progress in this world if everybody doesn't speak up and help? When you see something, say something. Isn't that
right.
something that we were supposed to do. You see
Yep.
something, you say something, you do something.
Yeah.
You don't just sit there and go, I'm not going to do anything.
I always have, but it seems so fearful. People were like, "Oh, let her handle it and let him handle it." And that's why there's so few of us that will really speak up for health freedom and freedom of choice, and also censorship, being able to speak your mind. And from all your
Right.
research, nobody should be silencing you. Trust me.
Thank you very much. Because it's just, for me, when you can't save an animal and you've picked up every rock and you've looked underneath of it and you can't find a solution, it's hard to admit that you can't help them.
Yeah.
And I never want to be in that position that I can't find something else that I might be able to do.
Right.
So obviously, if people come in and say, I don't want to do anything for this animal, I can't do anything, can you try to convince them that there may be something that's cost effective that could help the animal to give them more time that's quality? And I think somebody says that they don't want to know that. I don't think that's fair as a veterinarian who's caring for that animal. I need to speak up. I can't just say, you're right, there's nothing you can do. I don't do that. I won't do that. I have to let them know. And if they feel guilty, I'm sorry if they feel guilty, but I have an obligation to my oath to be direct to help these animals. And so hopefully people say, yeah, I can do that. And sure, I would be able to do that. And I can change the diet. And I can do that instead of being like, it's going to cost you $20,000 of MRIs, CAT scans, and blah, 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 and all this diagnostics. Let's try something simple for several $100s and see if we can make this animal work properly. And it could be as simple as doing a fecal transplant and changing the dog's life. And we took these cases that I just gave you with Dante and with Titan. I don't think they would have changed without the ozone and the fecal transplant. I truly believe neither one of them would have been still alive.
And if every doctor is saying you need to euthanize it because they don't understand the case or they were not willing to try something differently, then you are able to keep them alive and turn them around, that's why they're trying to shut you down. You make everybody look bad.
What I want to do is educate my colleagues and have them understand,
and
I could do that. That's not hard. What I'm doing is not hard.
No.
It's not like they have to go back and study for 3 years how to do acupuncture. Yeah, that's important, right? But the fecal transplant and the ozone are simple procedures that every veterinarian can add to their practice.
And they should.
I lecture at big conferences like NAVC and Midwest and Wild West and state conferences and stuff. And the veterinarians that will come and take that class, and I had one guy who he didn't want to walk across to go to the other class, so he stayed in the room where I was lecturing because his feet hurt. So he just sat there, very conventional guy, never did anything holistic. And he sat for my ozone lecture, and he is one of the biggest ozone users, and he's in Texas.
Oh, good.
And he doesn't know any other modalities, but he knows ozone, and it has changed his conventional practice. He just was so excited that he learned a tool, and here he went to a 1-hour lecture, and it changed his practice. I think that kind of stuff is exciting when somebody who doesn't even have a slight opening that they might think about acupuncture or herbs or anything like that, but they just try something like medical ozone, and it makes a huge difference.
Well, I really hope that a lot of vets have heard this podcast and willing to introduce a lot of these healing modalities. That would be great news. So
It'd be wonderful if people that are listening to this and they have vets and they can send it to them and have them listen to it, because if it's their dog and there's another choice to help it, or it's their cat or it's their horse and there's another way to help it, I think you have an opportunity to help your veterinarian learn more so that they would then have another choice instead of making the final decision. Thanks. Bye-bye.
Thanks so much for joining us for a brief meditation. So now I want you to just get comfortable and close your eyes. Take a deep breath in, all that healing energy, the beautiful energy around you. Just breathe it in. And now exhale, releasing any tension, worry, sadness, anything that is weighing on you. Breathe in again, filling your body with all that beautiful energy, and exhale, release. Release all the pressure. And I want you to visualize a pet that always made you feel calm and safe. And send gratitude to this wonderful animal that was in your life. Breathe in and breathe out. Now relax the muscles in your face, unclench your teeth, relax your jaw, and soften the brow. Allow your neck and shoulders to release, maybe shrug them up and relax them down the back. Let your hips feel heavy. Now your arms relax. Your legs relax. Make yourself so relaxed that others relax just by being around you. You are a wonderfully creative, spectacular being, surrounded by love. Love from your family, your friends, your animals. Notice how calm you feel as the breath moves in and out. Just begin to put your body at ease with several slow, deep breaths, creating a sense of warmth and heaviness in the body and the limbs. And this will intensify your feeling of relaxation. And then just imagine a peaceful, serene, natural scene. Maybe you are looking at a soothing waterfall, or you're on a deserted island, a cool mountaintop, or a sandy, warm beach. Maybe it's an autumn day in the park, or a cozy, warm fire. And just envision this peaceful scene so that you can practice relaxing. And use this positive emotional imagery to help calm the senses, synchronize the heart. Immersing yourself in nature, like walking in the forest, has this calming effect that can last for days. Just as it is doing it, provide that sensation of warmth and heaviness in the body and the limbs, so it intensifies that feeling of relaxation. And surround yourself with your animals whenever you can, because that helps you to feel grounded and calm and connected just in the presence of these majestic animals. Thanks for joining us today. Namaste.